Thank you so much, Louise, and thank you everybody for inviting me to present today. As Louise mentioned, my name is Renee Gleeson and I'm an accredited practicing dietitian. So I'm very happy to be presenting to you today on how to manage your health through diet. It sounds like quite a few of you are already familiar with some strategies to employ, but I wanted to cover a few different aspects today. I think that, Louise, I may need to get you to go through the slides. Is that right?
Yep.
Thank you so much. Like ordinarily I would do that, but I know that you've got the presentation, so I very much appreciate you helping me out with that. So with scleroderma and nutrition, I'm sure a lot of you are already familiar with some of the concepts, but there isn't one single scleroderma diet. And the reason for that is that everybody has different symptoms to a different degree and different nutrition needs. And that's very true of the general population. I think my job would be very boring if one single diet approach worked for everybody. Um, so it's there are some common symptoms though that are experienced by quite a few people with scleroderma, and unfortunately, like the nature of some of those symptoms can lead to nutritional risk and malnutrition, particularly undernutrition, not getting enough energy and nutrients. So some of the symptoms that I'm sure a few of you have experienced fatigue and inflammation, digestive issues, and difficulty swallowing or dysphagia. So diet can actually help quite a lot with some of these symptoms and experiences. And I'm just going to touch on a few of those now. Thank you, Louise, for the next slide. So in relation to fatigue, there's quite a few approaches that can work that are quite common for the different symptoms you can experience. And one of those is eating small amounts often. So this approach can help you get enough energy and nutrients in, because sometimes having the 3 meals a day, breakfast, lunch and dinner, they can be quite big meals that are overwhelming, and you might not be able to finish your meals and get energy and nutrients in that you need as a consequence. So eating 4 to 6 mini meals a day can be a strategy to assist with that, and also just means that it's not as tiring to try and eat. Also staying like hydrated can help as well. So you often hear 1.5 to 2 liters a day of fluid being the recommended intake, but that can vary from person to person depending on how much you weigh. Like we normally as dietitians look at 30 mils to 40 mils a kilo. And for some people, that can mean that their fluid requirements are actually quite high. But because of that, trying to aim for 1.5 litres a day can be a good benchmark to aim for. Some people are on fluid restrictions. So if your GP, if your doctor has recommended that for other medical conditions, just good to check with them about how much you should drink. Also, exercise and sleep can be of assistance, and it's a little bit outside my scope, but 30 to 60 minutes of exercise, if you can manage that per day, can assist, and trying to get more than 7 hours of sleep a day. Some people might find that, or may feel that their fatigue is associated with low iron levels or anemia, and it's always good to check with a GP or a medical professional before taking iron supplements. And the reason for that is that fatigue can also be a symptom of actually having too much iron in your body as well. There's a condition called hemochromatosis that is where there's iron overload in the body. So it's very important to have a sense of what your iron levels are like before taking supplements for iron. And they can also cause some unpleasant side effects like constipation. So it's good to check in with a GP first. So the next slide, Louise, thank you. So diet and inflammation. So you're probably familiar with the term inflammation, and there's acute inflammation, which can be useful, which helps with wound healing and helps if you like sprain your ankle, but chronic inflammation is something that can be harmful for the body, and in immune conditions like scleroderma, chronic inflammation is often present. So a way to help address chronic inflammation is to be eating fruits and vegetables regularly. And I put in there eating a rainbow, because eating a variety of different colors of fruits and veggies helps you to get antioxidants in your diet, which can help with reducing inflammation, and also just leads to a nice varied diet as well. So it's and quite often you get more benefits from eating the whole fruit and vegetables than from taking supplements as well. And also omega-3 fatty acids can assist as well. So eating oily fish, so that's things like salmon and sardines. Tinned tuna, to an extent, doesn't quite have as much omega-3 as fresh tuna, but this can still be a useful source and good source of protein as well. And walnuts are a plant source of omega-3. And there's also flaxseed or linseed, if you're not a fan of fish. Also, nut seeds, olive oil, good sources of vitamin E, which we know was helpful for reducing inflammation as well. Sometimes those foods in high amounts can be a little bit disruptive to the gut and reflux, which I'll talk about in a little bit. But small amounts, they can be quite helpful. And vitamin D is not only good for inflammation, but also good for your bone health as well, and helps you absorb calcium from your diet. So it's good to get out in the sun if you can. And there's only a few good sources of vitamin D in the diet. So we only really get about 10% of our vitamin D through diet. So oily fish, again, is a good source, and egg yolk, mushrooms that have been exposed to the sun. We might see vitamin D supplemented mushrooms in the supermarket, but a vitamin D supplement can be useful. And again, it's good to have your levels checked by a GP of vitamin D before considering utilizing a supplement, just in case. Like some people still do have adequate levels of vitamin D and don't necessarily need any additional, but it's just good to know like what your benchmark is. So next slide, thanks, Louise. Thank you. So diet and digestive issues. So you've heard and experienced a bit, no doubt, of these issues before, and there's a few acronyms that you come across, and GORD or GERD you may have heard about, depending on how you like to spell esophagus. So GORD is gastroesophageal reflux disease, and where the gastric acid is coming up into your esophagus. And a good thing about the small frequent meals is that approach can help for GORD, as well as fatigue management, and lots of there's lots of ways that can be useful. Sitting upright for 1 to 2 hours after eating can help reduce GORD, and sleeping elevated as well. It's also recommended to try and have a gap of 3 hours between eating and going to bed if you have GORD, or going to sleep, just to help reduce that symptom. And drinking alcohol, carbonated drinks with caffeine sometimes can exacerbate the issue as well. So it's good to try and limit those drinks if you can. I know it would be difficult personally for me not to go without some coffee, but it can be a helpful strategy. And there are certain foods that can exacerbate GORD or reflux as well. So these are tomatoes and citrus fruits, gas-producing fruits and vegetables like onions and cabbage, and lentils. Peppermint's an interesting one, because sometimes peppermint oil can be useful for people that have gut issues, but it can also affect reflux symptoms as well. And fried foods that are high in fat can often cause issues as well. So it's good to not limit your diet too much or unnecessarily. It's not like you have to avoid those foods if they don't cause you problems, but if they do, reducing those foods in your diet may assist with GORD. Thank you, Louise. So, and there's quite a plethora of bowel or gut issues you may experience with scleroderma. So, constipation is one, and that's when it's hard to pass your bowel motions. And sometimes we also consider in the hospital setting, if someone hasn't had their bowels open for more than 3 days, that may be when we need to intervene and try and get a person's bowels moving. But there's a lot of variability in bowel function, and for some people, only going a couple of times a week is normal, and for some people, they go every day. But if you do have constipation, staying well hydrated can be helpful. Nourishing fluids can be useful for like nutrition as well as hydration. So good to get, if you can tolerate them, milk-based or milk alternative drinks as well, can be helpful for providing energy and protein as well as fluid. And eating fiber containing food. So there's soluble and insoluble fiber, and your insoluble fiber foods that are found in fruit, veggies, and wheat containing products can be helpful for constipation. And there's also soluble fiber, which is found in oats and also in legumes and lentils. And even though it might seem a bit contradictory, like soluble fiber can help slow down the movement of food through your gastrointestinal tract, and that can actually help with diarrhea if you're having loose, watery bowel actions. So there's a few different approaches. It's also good to like try and stay hydrated if you have diarrhea as well, as you're losing extra fluid. And I haven't really touched on the FODMAP approach because I know that's been discussed earlier, but certainly there, as has been mentioned, and I know some people may not have heard that particular aspect of the previous presentations regarding FODMAPs, but there are some dietary approaches to managing constipation and diarrhea if those are chronic as well. And there, as mentioned before, there are dietitians who specialize in helping with the low FODMAP diet, and I'd very much recommend consulting those if you are having like irritable bowel syndrome type issues, and also just talking to your GP as well if you're having any change in your bowel habits as well. You may find when you're increasing particularly insoluble fiber in your diet, that you might start to get bloating and flatulence if you increase the fiber in your diet too quickly. So it's good to just introduce it slowly. We want to try and aim for 25 to 30 grams of fiber per day. And the Australian diet, generally, most people don't eat the 2 serves of fruit or 5 serves of vegetables that are recommended per day. So it's quite, generally speaking, a lot of people don't have a lot of fiber in their diet. So that's so it's not uncommon, and it is good not to introduce a whole lot of high fiber foods too quickly, because that can cause problems. And there are some foods that are high in fiber that are high in FODMAPs, and FODMAPs can be beneficial for gut health, but they can also cause unpleasant side effects. So that's where, if you're experiencing problems, seeing a dietitian who specializes in gastrointestinal issues is particularly useful. Next slide, Louise. Thank you. So touching on meal preparation, so if you have hard skin on your hands and fingers, and if you're experiencing fatigue, that can make meal preparation difficult. So there's quite a few different frozen and prepared meals out there that actually can be quite helpful if you're not feeling up to cooking, and can actually be quite nourishing as well. There are some meals that are higher in sodium and lower in vegetables than we would like, but there's quite a plethora out there that are quite high in fiber and high in protein and nutrients as well that can be useful. And some meal companies actually cater for special diets as well and provide texture modified meals, cater to people who need low FODMAP or low fructose diets. So yeah, there's more recognition of specialized dietary needs in the industry now. And you can also buy pre-cut vegetables and fruits if cutting up fruit and veg. And the same goes for some cuts of meat and chicken that can help minimize needing to do a lot of cutting and food preparation. There's also utensils that are specially designed for people who have difficulty with meal preparation, and occupational therapists are really good to consult in regards to those particular implements, and can also help with strategies for food preparation in more detail. And there are particular, I think a lot of those aids and equipment shops will have those specialised utensils that you would be after. Thank you. So moving on to chewing and swallowing difficulties. So swallowing difficulties are also known as, if you hear the term dysphagia, that refers to difficulty swallowing. And sometimes that can lead to problems such as aspiration pneumonia if food goes down the wrong way. That can lead to illness. So it's important to get a speech pathologist involved if you're having difficulty swallowing, because they're the experts in that area and can let you know some strategies to assist and what the best diet texture may be for you. And dietitians work very closely with speech pathologists because we also know that if you're having trouble swallowing and chewing, you may be eating less food and getting less nutrients that way. So it's important to include some nourishing foods or sources of protein in your diet, which are usually foods that are also high in energy and high in nutrients. So scrambled eggs, fish, yogurt, chicken with gravy, lasagna, they're just some options for you. And depending on the diet texture that's recommended for you, some foods you may be able to include, some not. So a speech pathologist can help work through with you about what foods are suitable, and a dietitian can help with the nutritional quality of those. Gravies and sauces are a great way for making the food easier to swallow, but they also add a bit more flavour because sometimes the foods can be a bit bland when the texture is modified. And also sipping fluids regularly can assist as well. Thank you, Louise. So I'm going to touch on Microstoma and Xerostomia, and hopefully I'm pronouncing those correctly. So with scleroderma, some people experience microstomia and reduced mouth opening, and that can make chewing and eating difficult. There's not a lot of nutritional strategies which I found for this condition, but dentists from my readings are quite useful with helping out with microstomia. And in some of what I've read, there's been recommendations for oral lubricants like saliva substitutes that can be useful for helping, and there seems to be some emerging strategies and technologies for assisting with microstomia. One of the articles I read was charmingly titled "Small Mouth, Big Problems." So I just thought, oh dear, I certainly didn't want to put that one in my references. But yeah, when researching the condition, it was mostly dentists that were talking about microstomia. Xerostomia is something that's a fancy word for dry mouth. Speech pathologists can also assist with dry mouth as well. Does make food difficult to swallow, and also when you have a dry mouth, food doesn't quite taste the same as well. So again, sipping fluids regularly can help keep the mouth moist, and the dentists are very much in favor of sipping water to avoid tooth decay, so they're not really in favor of like sugary drinks. And also, I guess, having the soft drinks, you're not really getting a lot of nutrition through those, but you certainly like want to be drinking. You don't want to be avoiding, if you can tolerate them, like milky drinks, because they can be quite nourishing. And I think having like water in between sips of any fluids that might be higher in sugar can help with your dental health as well. Chewing gum can assist with saliva stimulation, but again, the problem with using lollies or even using the sugar-free lollies, using lollies, there's the impact of sugar on your teeth. If you're using the sugar-free lollies, then sometimes they can cause gut problems. Sometimes they have some of those FODMAPs that have been discussed, and the sugar alcohols, which can cause gas problems in the gut. So just good to be aware of those side effects when using those products. There are some salivary sprays and mouthwashes out there as well that can be useful, and good to consult with pharmacy, dentists, speech pathology about those. Thank you, Louise. So aiming for a healthy weight. So with scleroderma, unfortunately, it does put people at risk of malnutrition. So you may have heard that a body mass index of 18.5 to 25 is what is considered healthy for a person under 65. And as dietitians, we used to look at a body mass index of 22 to 27 being ideal for people over 65. The body mass index is your weight divided by your height squared, and it just gives us a bit of an indication of the best weight range to be at to have good health outcomes. And emerging research is coming out now saying that a BMI range of 24 to 30 is actually now associated with better health if you're over 65. So being of what we previously considered a higher weight, as you get older, it's actually more protective for you, and can actually help if you get unwell and start losing weight, having unplanned weight loss. Being at a higher weight is helpful for being able to maintain better health. So it varies widely, the definition of with weight loss and malnutrition. There's different parameters that we look at, but if you're losing a kilo a week or about 4 kilos over a month and you haven't planned to lose weight, I think it's good to talk to your GP about getting a dietitian referral, or also getting some investigations done as to like what might be contributing as well. And also, like, if you notice that you're having fatigue, if there's wounds that aren't healing, if you're getting unwell, frequent colds, then that might be an indication that you may be developing malnutrition or undernutrition. So it's good to have a discussion with your GP in that case. Again, small frequent meals can help to get enough energy and nutrients in. Sorry, there's a little bit of repetition, but some of the same strategies apply for lots of different aspects. And consuming foods that are high in energy and protein, getting more bang for your buck in what you eat. So meat, chicken, fish, lentils, nuts, eggs, dairy foods, dairy alternatives like your soy milks are often high in protein, and it's good to look for, if you're using an alternative to cow's milk, making sure that you're checking the labels to make sure that the protein and the calcium content is similar to what you get in cow's milk, because not all your milk alternatives or cow's milk alternatives are high in protein, and not all of them are fortified with calcium either. So it's good to look at that when shopping. So nourishing drinks such as smoothies can be useful, particularly if you find it difficult to be eating solid food. Adding oils or avocado can help boost energy intake as well. Again, it's just watching the quantities if you have gut issues relating to high-fat diet. And of course, a dietitian can provide individualized advice as well. Thanks, Louise. So what if you're admitted to hospital? So there are dietitians who work in or consult for most hospitals, and usually when you're admitted, the nursing staff will do a bit of a screen, and they will, as part of that screen, if there's decreased intake that's reported over a few days and unplanned loss of weight, that'll usually trigger a referral to the dietitian. Um, Now, it's certainly up to you if you want dietetic input or not, but we'll usually get referred under those particular circumstances. And if you have swallowing difficulties, that would often trigger a referral to speech pathology. Um, Occupational therapists usually see most patients, and particularly in the rehabilitation setting, and they can assist with meal preparation and feeding strategies during your stay if that's needed. In terms of supplement use, dietitians, doctors, and the pharmacists at hospital can advise on supplement use. I did a little bit of reading into supplements and scleroderma, and it from what I had read, it's been advised not to take like collagen supplements or excess vitamin C, as vitamin C stimulates collagen production. And really, there still wasn't a lot of evidence about vitamin E supplementation as well. Like it's always advisable to consult with your pharmacist or a GP before you take any additional supplements. Just to look at if there's going to be any interactions with other medications you're taking, and just to see if they will be helpful if you're in your individual circumstance as well. Thanks, Louise. So with supplement drinks, you've probably heard about a few of these, and I'm mindful of not wanting to promote any particular brands, but you've probably heard or seen lots of advertising for supplement drinks like Ensure and Sustagen. So dietitians usually try a food first approach. So we try and look at nourishing foods and fluids first before we'd be recommending supplements. It's a little bit more enjoyable to eat food rather than take nutritional supplements, but they do have their place. So usually with a high energy, high protein diet, we're focusing on some of the foods I've mentioned beforehand, and there might be some snacks that we encourage and utilize, such as cheese and biscuits if you can tolerate them, yogurt, for example. We might add in flavored milks if they're drinks you can tolerate, just to get some extra energy and protein into the diet. And supplement drinks are useful if you've tried those snacks and you're still not meeting your energy and protein requirements that we've calculated for you. They can help boost your energy, protein, and nutrient intake. So the ones you often hear about are sort of milky style. So they either contain milk protein or they might be based on soy. And so your Sustagen contains milk and hence lactose, so isn't suitable if you're on a low lactose diet. But there are fruit juice style drinks that don't actually contain any fruit juice, but they have that kind of flavor to them. So they're quite helpful for people who don't like milk or who can't tolerate milk drinks. A lot of the milky style supplements, however, are based on soy and are low lactose, so can quite often be tolerated by people who are on lower lactose diets as well. And drinking these supplements between meals is a better strategy than trying to have them with your meals. Some people prefer to have them at mealtime, but having them in between means that it's not impacting on your intake of meals. And it quite often it's good to have a dietitian involved if you are utilising these supplements, because they can help advise on how often to take them, like what's best for your individual circumstance and requirements. But also sometimes they can help you to source them more economically, because they can get quite expensive if just sourced through the supermarket or through a pharmacy. So yeah, Louise, I think we're on to the, I think I've pretty much, I know I'm probably was meant to be speaking for 45 minutes, and I think I've managed to sort of get through it despite all the technical difficulties in about half an hour. I have on the next slide included some references as well. So there were three key references that I utilised, so including the Scleroderma Australia handout on nutritional needs in scleroderma, and I did utilise some resources from overseas as well, in the UK and the US as well. So there's certainly some good resources out there from that I've seen from Scleroderma Australia as well. So I definitely recommend checking those out and talking to a dietitian in more detail as well. So yeah, I'm happy to take the questions. I can see some questions in the chat starting to pop through now. So thank you very much for your time, everybody.